Good day, everyone. Today I will discuss the epidemiology and control of HIV/AIDS in Peru, including the history of the epidemics, surveillance methods, burden of disease, prevention strategies, barriers to control, progress towards the UNAIDS 95-95-95 targets, and a proposed intervention to strengthen the HIV prevention and treatment efforts. Today I will discuss the epidemiology and control of HIV/AIDS in Peru. This presentation will review the country background, the history of HIV epidemic, surveillance systems, and epidemiologic trends, prevention strategies, barriers to care, progress towards UNAIDS goals, and a proposed intervention to improve HIV prevention and treatment outcomes. Peru is located in South America and has a population of more than 34 million people. Lima serves as the country's political, economic, and healthcare center. Although Peru has experienced significant economic growth, disparities remain in healthcare access, especially among rural and indigenous communities. This disparity influences the prevention and control to HIV/AIDS. Human immunodeficiency virus, or HIV, attacks the CD4 T lymphocytes and weakens the immune system. Without treatment, HIV can progress to acquire immunodeficiency syndrome, or AIDS. Advancing antiretroviral therapy have transformed HIV from a fatal disease into a manageable chronic condition. The HIV epidemic in Peru emerged in the early 1980s, shortly after cases were reported in the United States. Initially, most infections occur among men who have sex with men. The epidemic later expanded to include transgender women, sex workers, and other vulnerable populations. A major turn-on point occurred in 2004 when public access to antiretroviral therapy was expanded nationwide. Peru experienced a concentrated HIV epidemic. This means HIV prevalence remained relatively low in the general population, but reaches much higher levels among key populations, particularly men who have sex with men and transgender women. This epidemiologic sorry, epidemiologic pattern continues today. Peru uses multiple surveillance systems to monitor HIV transmission patterns, treatments, outcomes, and disease trends. These data help guide public health decisions making and resource allocation. Passive surveillance serves as the foundation of Peru's HIV monitoring system. Healthcare providers and laboratories are required to report confirmed HIV cases to the Ministry of Health. This allows continuous monitoring of disease trends. Sentinel surveillance focuses on populations at highest risk. Behavioral surveillance evaluates social and behavioral risk factors, while laboratory surveillance monitors viral suppressions and treatment outcomes among people receiving ART. Approximately 130,000 individuals were living with HIV in Peru in 2024, although the country's prevalence remains relatively low compared with some nations. New infections continue to occur each year, particularly among key populations. This comparison demonstrates that Peru's overall HIV prevalence is lower than the other countries like Brazil, Chile, and Colombia. However, prevalence alone does not capture the disproportionate burden among vulnerable populations. AIDS-related mortality has declined substantially due to the improved testing, early diagnosis, and expand access to antiretroviral therapy. This figure, for example, demonstrate a substantial reduction in AIDS related to death over the past 2 decades. Death, Deaths decreased from approximately 2,600 in 2000 to approximately 870 in 2024, representing a decline of more than 65%. Most HIV cases occur among young adult males living in urban areas like Lima and Callao account for a large proportion of infections because of population density and greater concentration of key population. These figures highlight the dramatic disparities in HIV prevalence. The general population prevalence is approximately like 0.4%, while prevalence among MSM exceeds the 10% and may exceed the 20% among transgender women. HIV transmission in Peru is influenced by both behavioral and structural determinants, like social stigma, discrimination, and healthcare barriers significantly contribute to vulnerability among high-risk population. Peru has implemented several prevention strategies, including condom distribution, HIV education campaigns, expanding testing, treatment programs, and prevention of mother-to-child transmission. The PrEP, has emerged as one of the most effective HIV prevention strategies available. Expanding PrEP access is critical for reducing new HIV infection in Peru. PrEP is a biomedical prevention strategy in which HIV-negative individuals take medication to prevent infection. Research has shown that PrEP reduces sexual HIV transmission by more than 90% when it's used consistently. The UNAIDS initiative aims to the 95% of people living with HIV to know their status, the 90% of diagnosed individuals to receive treatment, and the 95% of treated individuals to achieve virus suppression. Peru has achieved excellent virus suppression rates among individuals receiving treatment. However, gaps remain in diagnosis and treatment coverage. Increasing HIV testing and linkage to care will be critical to achieving all UNAIDS targets. Despite advances in treatment and prevention, HIV control efforts continue to face challenges related to stigma, discrimination, rural healthcare disparities, poverty, limited PrEP access, and mental health concerns. This intervention will use mobile health units to provide HIV testing, counseling, PrEP service, content distribution, peer navigation, mental health referrals, and linkage to care in Lima and Callao. The goal is to reduce barriers and improve access among populations at highest risk. In conclusion, Peru has made significant progress in HIV prevention, surveillance, and treatment. However, HIV remains concentrated among MSM and transgender women. Continue investing in testing, treatment, PrEP expansion, healthcare equity, and stigma reduction would be essential for achieving long-term epidemic control and meeting future UNAIDS goals. The last page is my reference and the information where I found most of this for most of this presentation. Thank you.